Hello, everyone. My name is Bill McKendry, and I'm the Executive Director of the Pennsylvania Healthcare Benefit Solutions Program, PHBSP. We help people navigate through the complexities of programs like Medicare and Medicaid in the private health insurance marketplace. We provide individual counseling, patient advocacy services, and we produce community education presentations like the one you're watching now. The title of this presentation is How to Navigate Medicare's Part D Plan Finder. I hope you enjoy the presentation.
Hello. I would like to welcome you to How to Find a Medicare Part D Plan, a presentation created for you by the Pennsylvania Healthcare Benefit Solutions Program in association with the University of Pittsburgh School of Pharmacy. The Pennsylvania Healthcare Benefit Solutions Program is a nonprofit organization focused on helping individuals navigate the complexities of healthcare systems such as Medicare and Medicaid through the provision of counseling, education, and advocacy services for Pennsylvania residents to enable equitable access to high-quality, affordable health care. The purpose of this presentation is to enact PHBSP's vision through the creation of a free resource for anyone to utilize in their selection of a Medicare Part D prescription drug plan. To begin the process of discovering your plan options, please navigate to www.medicare.gov on a computer or tablet. Once you have opened the web page, locate the tab at the top of the page that says Health and Drug Plans. After clicking on the Health and Drug Plans tab, a drop-down menu will open. Under the column on the left titled Find and Compare, select the first option at the top titled Find Health and Drug Plans and click on it. You will be brought to a new page that will start your personalized journey to find Medicare coverage options. First, fill in your zip code. This zip code should be the area that you want your pharmacy to reside in. Next, select a plan type. If you click the small arrow, a drop list will appear. You may choose a unique plan that you want. If you would like to hear more information about these different types of plans, please pick the last option. I want to learn more about Medicare options before I see plans. Once you have selected the Drug Plan Part D option, click Apply. Then click Start. The next page asks if you are part of any program that helps with your cost of healthcare. Please choose any option that applies to you. If you are unsure about whether you are receiving additional help with your costs from any of these programs, or if you are planning to enroll in any of these programs, you may choose the fourth option labeled I'm not sure. For this tutorial, we will be using this filter. Once you choose this as your answer, click Continue without logging in. If you already have a Medicare.gov account, you may choose to log in, but it is not required. The next page will ask if you want to see your drug costs when you compare plans. In order to get the most comprehensive information for each plan, please select Yes for this question. Then click Next. The next page will start the process of adding your personalized medication list. Type the name of your drug into the text box. This can be found on the label of your prescription bottle given to you by your pharmacy. A list of options will be provided to you. After you finish typing the correct medication name, click the button Add Drug. The next page that will appear we'll have 3 different boxes for you to specify the dosage strength, quantity, and frequency. The first box is the dose of the prescription. Select the correct strength and form of the drug from the drop-down menu. This information can be found on the label of your prescription bottle given to you by your pharmacy. For this example, the dosage of the fluoxetine prescription is a 20 milligram capsule. For the box labeled quantity, add how many capsules or tablets you receive each time you pick up your prescription. This can also be found on the prescription label provided to you by your pharmacy. The last box labeled frequency refers to how often you pick up your specific prescription. Please select the usual time in between refills for this prescription. In this example, 30 capsules of fluoxetine, 20 milligrams, are being picked up each month. When you have verified that all of this information is correct, click the green button, Add to my drug list. Once a prescription has been added to your drug list, you may edit the drug if there are any errors. You may also remove the drug if you need to. If this is the only prescription medication you have, you may click Done Adding Drugs and continue with the process. However, you may also choose to add another prescription to your drug list. If you have a brand name prescription, it is extremely important to add the correct medication to your drug list. Brand name medications will usually drastically impact drug coverage options. For this example, we will use the brand name of fluoxetine, also called Prozac, to compare coverage between generic and brand name medications. Once you have selected your brand name drug, you can click Add Drug once again. A pop-up box will advise you that a generic is available for this medication. If you mean to add the generic medication, you may click Add Generic. However, we will be choosing Add Brand Name instead, in order to show you the difference between generic versus brand name medication cost and coverage. On the next page, ensure that the dosage, quantity, and frequency of the prescription are accurate once again before clicking Add to my drug list. In this video, we will be showing you differences in cost and coverage on Part D plans for 2 different generic drugs, fluoxetine and levothyroxine, as well as the cost and coverage for a brand name prescription. Before selecting Done Adding Drugs, make sure all of the medications you take and want to have covered by the Part D plan are included in your drug list. The next step of this process is to add the names of the pharmacy where you will get your prescriptions filled. You do not have to choose the pharmacy you currently use. However, being specific in this step will ensure the most accurate estimated drug costs. Ensure that the zip code you have typed in previously is accurate. You may choose a different zip code at this time. The maximum distance from your location can be altered by selecting the blue filter button and choosing the distance of your choice. If this is your first time exploring Part D plans or have challenges going to a pharmacy to pick up medications, you may choose to have a mail order pharmacy added. You have the ability to choose up to 5 pharmacies near you. If you add a pharmacy and want to remove it, you may always hit the small X next to the pharmacy name at the bottom of the page. If you have a specific pharmacy in mind, you can type it in the box labeled Name of Pharmacy, next to the box where you entered your zip code. Click the Find Pharmacy button when you are ready. You may choose from the list of pharmacies that match with your search preference. Click Add Pharmacy in order to add it to the list at the bottom. Once you have selected all preferred pharmacies, you may click the Done button. The next page will bring you to all of the Part D plans that you are eligible for. First, verify that the location and the plan type are accurate. If you are looking for a specific insurance carrier, click on the box at the top left of your screen, and a drop-down menu with your options will be shown. You may also choose to filter out star ratings for a group of plans. This step may ensure quality of coverage. On the right side, the option to organize the eligible plans is available. Plans can be sorted by either lowest drug cost, lowest premium cost, or lowest drug and premium cost. By using filters, Medicare.gov is able to organize available plans in order of relevance to your specific needs. The first plan that appears in your results will be the plan that best fits the filters you have selected. In this video, we will explore the plan Smart Script Smart Saver by Aetna Medicare. You may find the plan ID next to the insurance company name. On this homepage, each prescription plan will include a summary of drug pricing. The monthly premium is the amount that you will be paying for the plan every month. The total drug and premium cost for the year, if you have this plan, will also be listed. The deductible is the amount that you must pay out of pocket before the Part D plan will cover part of your prescription drug cost. Usually, if the monthly premium is lower, the deductible will be higher. You can also see the number of your retail pharmacies that are covered by this plan. For more information about the plan, you can click on the plan details at the bottom. Once you click the plan details, you will be brought to a new page. The first information you will see is the monthly premium and the estimated total drug cost for both retail and mail-order pharmacy. This value is not taken into consideration, but you will also be paying monthly for coverage. Above the What You'll Pay section are the contact numbers for the prescription plan. If you have any questions regarding the plan, after looking through the information on this website, we suggest you call one of these numbers. Additional details about the plan are below the summary once you scroll down. The Overview section will contain information that you have mostly already seen at this point. Again, the total monthly premium will be listed, as well as your deductible. Some plans will also have contact information listed on this page, such as an address. Below this information section is the drug coverage section. The first information you will see in the drug coverage information is the status of the pharmacies that you had previously selected. There will be 3 types of categories your pharmacy will fall under. Preferred in-network will usually guarantee the lowest prescription drug costs. In-network pharmacy will guarantee that the plan will cover part of the prescription drug cost. However, the amount that you pay will be higher than the preferred in-network pharmacy. Out-of-network pharmacies are not contracted with the plan, and therefore the plan will not cover any part of your prescription drug costs at these pharmacies. You have the option to find an in-network pharmacy if you want to remove an out-of-network pharmacy. This section will also include whether or not the plan will cover mail-order pharmacy. Please note that for mail-order pharmacies, costs may vary based on the specific mail-order pharmacy that you choose. Below the pharmacy status section is the yearly drug cost per pharmacy. Each one of the medications that you had added will be listed here. You can compare the total yearly drug cost that this plan will have you pay depending on which pharmacy you choose. As you can see, the preferred in-network pharmacies have the lowest total drug costs for the year. The out-of-network pharmacies have substantially higher drug costs, since this specific plan does not cover prescriptions picked up at this location. The in-network pharmacies will also have a lower drug cost than the out-of-network pharmacies. However, they will not be as low as the preferred pharmacies. The next section is the estimated total drug and premium cost. This is the sum of what you will pay for your prescriptions, as well as what you will pay per month for coverage. The first row will break down the total drug cost plus premium cost for each pharmacy. The second row will break down when you meet your deductible. The third row is when you will enter the coverage gap. The coverage gap is a point of your Part D plan in which the plan will not cover any of your prescription drug costs. This starts when you reach the initial coverage limit. In 2023, the initial coverage limit is $4,660. The coverage gap ends once you reach an out-of-pocket limit of $7,400. Anything that you have paid for your prescriptions up to this limit, including what contributed to your initial coverage limit, will contribute to this out-of-pocket limit. Once the coverage gap ends, the plan will start paying 95% of your prescription drug coverage for certain generic medications. The next section breaks down the estimated total monthly drug cost. Each row is a different month, and you are able to compare what you paid for your prescriptions. Each row being a different month, you're able to compare what you will pay at each pharmacy. Please note that the mail-order pharmacy total monthly drug cost will differ than the regular retail pharmacies. You may see that the mail-order pharmacy will require a larger premium for only select months. After scrolling down, you will be able to see the estimated drug costs during the different coverage phases for each pharmacy you previously selected. Coverage phase refers to the amount of money you and your insurance company pay at a certain time in the year. For more information on what each coverage phase means, click Learn More about Coverage Phases. You may click on a specific pharmacy to see the breakdown of prices at separate points of coverage. The retail cost is the amount of money that you would pay without prescription drug coverage at the specific retail location. The cost before the deductible is the amount of money that you will pay before your plan starts to pay a percent of the drug coverage. The deductible will usually only apply to brand medications. Once you hit the deductible, the plan will cover part of your prescription. The coverage gap happens when both you and your plan spend a sum of $4,660 on medications, in which case the plan does not pay for your prescriptions. However, you will pay no more than 25% of the cost until you reach the out-of-pocket limit of $7,400. Once again, anything that you have paid for your prescriptions, including what contributed to your initial coverage limit, will be contributed to this out-of-pocket limit. Once the coverage gap ends, the plan will start paying 95% of certain generic prescriptions. To view more drug coverage, you may click View More Drug Coverage. You may also explore star ratings to see the overall stars for your choice of plan. Here, you can further see the summary of ratings, as well as other ratings. This will show you how well the plan covers medications compared to the monthly premium and drug costs. This feature can help you determine whether a certain plan will be most effective for you. If you find that you are happy with this specific Part D plan, you may choose to enroll online. If you would like to explore more prescription drug plans, click Back to Search Results. After finding a few plans that meet your needs, you can compare different plans to narrow down your options by pressing the Add to Compare checkbox. This button is next to the Plan Detail button, and it will bring up a comparison bar at the bottom of the screen. You can pick up to 3 plans to compare, which you can pick by scrolling down the plan options. After finding what plans are best for your needs, you can hit the Compare button to bring up side-by-side comparisons. After hitting the Compare button, a screen will pop up with both plans pulled up side by side to one another. This screen will give you the monthly premium of each Part D plan, as well as an overview of each plan. This overview contains information such as the star rating, total monthly premium, and yearly drug deductible. Once you scroll down, you will see a comparison of drug coverage and cost. This includes the amount of drug products in your care plan that will be covered between both plans. Below the drug coverage, it will also compare total drug plus premium cost for the rest of the year, as well as the preference for each pharmacy, depending on your plan. We hope that you have found this video helpful, and we understand that you may be unfamiliar with the process of selecting a Part D plan, and that it is challenging regardless of your experience with Medicare. This presentation acts as a resource to provide a baseline instruction for the Medicare.gov website, and we recognize that you may still have unanswered questions after watching this tutorial. You are not alone in your navigation of the Medicare system, and our organization exists specifically to help you through the entirety of your experiences with the healthcare system. The Pennsylvania Healthcare Benefits Solutions Program is here to ensure that you are provided with an affordable healthcare plan that meets your specific needs and concerns. For any additional questions, do not hesitate to reach out to our organization for personal assistance. You can contact us by phone at 412-266-8322 or send us a message on our website at phbsp.org/contact. Thank you so much for watching.